The Supplemental Omnibus Finance Committee will come to order. Thank you, members. A couple quick announcements. If you are sitting here in the audience wondering if we are going to take up state government or judiciary tonight, we are not going to be taking those up. We are going to work on HHS tonight. Housing is complete, and it sounds like energy is about done and will be posted here shortly. So those are the three bills that we are going to do tonight. And like I said, state government and judiciary tomorrow. Another very important announcement is the Sweets and Treats on second floor. It's open until 8:30 tonight. That was big. Yeah, exactly. I am buying for everybody. So we have the HHS in front of us. We have 8 articles with this bill. Thank you, Representative Dean, Chair Dean, and Chair Schumacher, and Chair Benson for being in front of us. We have Article 22 before us. Members, you just have Article 22, Article 23, and Article 24 before you. We're going to try again to consolidate and help with the paper flow. We will finish those 3 articles, move them away, and we'll pass out the next 3 articles, and we'll continue to do it that way. With that, I would like to just have comments from the chairs about their bill. Chair Dean, welcome. Good to see you.
Thank you, Madam Chair and members. We are pleased to put forward the Omnibus Health and Human Services packages that you have before us. For some folks, we know that we will not be moving all of those, but the majority of them where we have agreement, and look to be moving those through, and happy to answer any questions.
Thank you, Chair Dean. And members, we do not have a spreadsheet at this moment. It is being worked on. We may have to take a little recess after we go through the policy and the articles. Yeah, we don't have an appropriation article either. So we have a little more work to do tonight, but we can start getting through this. Chair Schumacher, welcome. Thank you.
Thank you, Madam Chair and members. Obviously, there's a lot here. There's a lot in Health and Human Services, and we look forward to the discussion tonight.
Thank you, Commissioner, or Senator, or Chair Schumacher. I'll get this right. Yeah, there you go. I went through it all. Governor Schumacher, I got it. Chair Benson, I think you're back there. I don't see you.
Hello, Madam Chair. Thanks, everybody, for the patience to take up HHS at this hour. It could have been worse. We do not have a spreadsheet, and we have not reached agreement on all financial provisions, but in the interest of all of your attention and work for the reviser, we wanted to move policy provisions. This gets the language out in front of everybody, and hopefully makes it easier for the governor, his commissioners who are here, to point out things that would be exceptionally controversial and would be a challenge for getting this bill signed. And there's some really key reforms. It's a small HHS bill, but there are some things that point to a direction of good bipartisan work. Senator Rosen and Senator Kiffmeyer, both members of this committee, were key contributors to the work in this bill, and so I thank them for their help.
Thank you, Chair Benson. Okay, so with that, we are going to start with Article 22. You don't want to do that. Just go straight. Okay. Yeah, we have. I think so. Yeah, I think so. Yes. Thank you. Members, I think we're going to go ahead with our testimony from our commissioners. So Representative Dean and Representative Schumacher and Senator Benson, if you wouldn't mind, we're going to ask Commissioner Malcolm to come up, Commissioner Johnson, and Commissioner Lumen, please. We invite you to the party, and then we send you away. Hello, Commissioner Malcolm, how are you?
Good evening, Madam Chair.
Commissioner Johnson, nice to see you. Hi, Commissioner Lumen. Who would like to go first?
I'm still studying.
Madam Chair, my comments are very brief, so I can go ahead and go first if that's okay.
That's fine.
Great, thank you. For the record, my name is Jessica Lumen. I'm the Commissioner of the Minnesota Department of Commerce. I specifically just want to point out an area of concern in Article 24 that relates to short-term limited duration health plans. Again, at the Minnesota Department of Commerce, one of our roles is to regulate insurance companies in the state of Minnesota. And we have been working closely with our fellow departments as well as with several patient advocacy groups and some of our health plans here in Minnesota. And there are great concerns about this language and about the expansion of the use of short-term limited duration plans in Minnesota. Very briefly, our concerns are really around three things. One is that these plans actually don't really cover much. They don't provide adequate health coverage, and frankly, they're plans that were initially designed as a bridge coverage between actual comprehensive coverage. They are currently actually available in Minnesota for up to 6 months, and it's for when you're in between health insurance, that this is the type of insurance that you may want to purchase. But short-term limited duration plans don't cover comprehensive benefits or many of the other things that Minnesotans need if they possibly are going to unfortunately get sick in Minnesota. The other problem with this bill particularly is that it is not short-term, but is actually full-time coverage in Minnesota, as with in health insurance, as with other insurance policies. We have an annual renewal, and we have a plan year, which is a one-year term for health insurance in Minnesota. This actually creates a new type of insurance that it could be up to 2 years, 1 year plus renewable for another year, and that makes it health insurance, not a short-term plan anymore. And finally, our real concern here from the Department of Commerce's perspective is also that this disrupts the really hard work that this legislative body and the governor have done to stabilize our individual market with the reinsurance plan that was passed, particularly that reduced premiums in the individual market by 25%. That plan is currently in effect, the reinsurance program for plan years 18 and 19. And we're really concerned that by bringing short-term limited duration plans online for Minnesotans, that we will pull out the healthy people who are currently in our individual market, and that will destabilize and raise the rates for all of the other people who are participating in our health care plans. So those are our primary concerns with the short-term limited duration. I thank you very much for the time.
Thank you, Commissioner Lumen. Are there any comments, questions, discussions? Thank you very much, Commissioner. Commissioner Malcolm?
Thank you, Madam Chair and members of the committee. We want to thank you for the very hard work you're putting into this Omnibus Supplemental Budget Bill. It's a little hard to comment without seeing the spreadsheets yet, but I will, with your leave, just mention the issues that we hope to see in the bill, concerns that with things that may not be in the bill, realizing you're still working on it. While we do value some of the investments the Conference Committee is making in prevention, we're very troubled by how few of the governor's supplemental budget proposals for public health were actually included or have been so far. Regarding the prevention of elder abuse, I know that both bodies, House and Senate, have worked hard and continue to work, we hope and believe, to take steps to address this urgent and vital issue. I just want to reiterate again the governor's view that it's critical that some meaningful change happen this session. We have worked with the members of the legislature, citizen advocates, providers, stakeholders to find a positive solution that is sufficient to the urgency of this issue and takes advantage of the bipartisan momentum that exists right now. We are concerned that the conference committee's ultimate report will be comprehensive and contain essential elements of reform. And as we have pointed out, the earlier funding proposals did not match our fiscal notes. Just want to reiterate that the governor has suggested a standalone bill in this case. He has made a revised proposal last Friday that has been shared with both bodies and now is highly prioritized on his top priorities and now costs just $16 million in general fund spending over the entire next 3 years. We believe strongly that elder abuse is just too important a topic to wait until the next session to make progress. I want to repeat a topic we've talked about before. The bill lacks and we would see policy language if this were your intent, I believe. So I think this is an omission that the governor will be concerned about. Lacks the governor's request for increased safe drinking water fees by a modest 28 cents per connection per month. This fee hasn't increased since 2005, and this small increase is essential for us to be able to maintain our proactive efforts with public water suppliers to ensure that all Minnesotans have safe drinking water, particularly important for smaller and rural systems that lack resources and technical capacity of their own. We'd hate to get into the situation where we have to see systems failing before we can step in and help with mitigation efforts. Prevention is a far superior strategy. On the topic of medical cannabis, we haven't seen your final intentions here, but we hope that you will adopt the governor's realignment of the medical cannabis program appropriations from the state government special revenue fund in order to ensure that the fees that are already being paid by manufacturers and patients can be used for their benefit, to fund our 24/7 patient registry, our expert staff who are working to ensure manufacturer quality, and to staff a very busy call center as this program has continued to grow. This adjustment does not change any current law, does not raise fees, and has no general fund impact or cost to Minnesota taxpayers. On the topic of the House public safety portion of the bill, I'm concerned with the repeal of Minnesota Statute Section 609.5315, Subdivision 5C, which is the forfeited cash provision. The forfeited cash, which is collected by law enforcement in this particular provision, comes to MDH to support safe harbor services to help sexually exploited youth. Removing this provision will have a detrimental impact on MDH's ability to provide these necessary services to highly vulnerable youth. On another topic related to the Hubbard County Resort, we also continue to have concerns about the bill's language that establishes a variance in law for a Hubbard County Resort. Our staff have been working closely with this resort to find a solution that works for all within our existing processes. We do not believe that there's an undue burden to install a dump station on site, so we feel strongly that a variance is not needed in this incident and that a dangerous precedent would be set by granting one in statute. As Commissioner Lumen mentioned with regard to changes in the coverage system, we're very concerned as well about the changes in short-term individual insurance coverage. Allowing what was intended to be short-term coverage for up to 2 years and allowing exclusion of coverage for pre-existing conditions for the first 6 months will not only have a deleterious effect on the insurance market, as Commissioner Lumen has testified, but it will also have a negative impact on consumers, not only from a cost perspective, but on their health as well. 6 months and 2 years are a long time to not have the benefit of preventive coverage or coverage to deal with illnesses when they are first discovered. I'd like to also draw your attention to an urgent general fund request that was included in the governor's bonding bill, $2.37 million in one-time resources to replace outdated equipment in our public health laboratory. There are some specific and new pieces of equipment that are highly necessary to ensure that our lab continues to provide timely and urgent testing of health threats, including infectious disease agents like Ebola, bioterrorism agents, and PFCs in the water, and radiation. So in conclusion, Madam Chair, we again appreciate all the work that this body does to help us ensure that Minnesotans can remain healthy. We have some challenges before us in these remaining days, but we thank you very much for your attention and your consideration.
Thank you, Commissioner Malcolm. Are there any questions for the Commissioner? Discussion? Thank you so much for coming. Commissioner Johnson.
Thank you, Madam Chair. Chuck Johnson serves Acting Commissioner of the Department of Human Services. There are, again, it's a little bit difficult without a spreadsheet to comment on the bill, and so reviewing the provisions now. Obviously, there are several of the governor's priorities that didn't even make it to this table. I won't run through that, but I think some of the concern in the human services area is simply that there are issues that the governor prioritized that have not even followed through to this step in the process. As Commissioner Malcolm said, we're certainly concerned about what happens in the area of the adult abuse proposals. I know it's still being worked on. We'll appreciate the opportunity to see that when you have it. And also understand that there's work continuing to go on how the opioid pieces will be fit within this bill. We're disappointed that the opioid proposal appears to not include holding the pharmaceutical companies accountable for their role in this problem that we have. I understand that, Madam Chair, you and others have worked very hard on that, and this is where we are. We're certainly disappointed in that, and we'll have to see what proposals are included, but hope that you have a package that balances treatment, prevention, and law enforcement needs within addressing that crisis going forward. Within the bill that we can see now, there are several things that we think are glad to see here. Data sharing for third-party liability within our healthcare programs, codifying the enhanced rate for personal care attendants, which is an important thing to do this session, creating electronic verification eligibility within our home services as well, extension of the American Indian Advisory Councils, and also appreciate the work that's been done on the Child Care Assistance Program and working through those pieces of the program and using the federal money as best we can to meet the needs within that program. Some of our concerns within the bill, I think what's here for NEMT, non-emergency medical transportation, is good, but the one piece that's missing is the enrollment of the individual drivers as providers. And having just come from talking for 2 hours about fraud, that's what a internal control looks like, is having a registration of each individual provider so that we can track, we can make sure the bad actors aren't part of the program anymore, we can ensure they aren't showing up working for another company and so forth. We believe that's a piece that should be included in this proposal. We also have opposed and do oppose the hiring of a vendor to do eligibility checks around medical assistance and SNAP eligibility. This is repetitive of work that we already do, work that is scheduled to go on healthcare programs through the periodic data match. We're also not sure that what's written in the bill is operationalizable and that we could make it work. We're disappointed that this bill continues to include the child and teen checkup change that we opposed when it moved through the Senate. This essentially allows providers, doctors, to continue to earn an enhanced rate even when they're not following the American Academy of Pediatrics recommendations for how you should do screening and what should be considered in screening children. The bill also includes a requirement that we reconcile the Minnesota Care premiums. I understand that not everyone is happy with our decision to not reconcile those premiums and to write that off, but we believe that is the right decision. We made that decision based on the best work that we had done to try to reconcile the premiums. We believe it's important to move on, not put Minnesota families through that kind of turmoil that would happen if we were sending them out bills on these issues. We're also concerned that the bill removes rulemaking authority for the agency. This is something that we believe is an important part of the administrative obligations of an agency, to have the ability to create rules, to implement the laws that you pass, and to ensure that there's structure and consistency in how programs are carried out across the state, and that we have the force of law that a rule provides when we're doing that. And we're also so, Mr. Chair, Madam Chair, thank you for the opportunity to share those remarks. Again, as we see the spreadsheet, I understand we'll learn more about the scale of work that you're planning on doing in some of these areas, and I'm sure we'll have some more comments at that point.
Thank you, Commissioner Johnson. Yes, we definitely have a lot of work ahead of us, but do appreciate you coming. Thank you so much. With that, I think we could start with adopting the policy on Article 24. Members, we're going to start with the A18. Excuse me, I'm sorry. I'm out of order. We're going to start with Article 22, the healthcare article, the A18-0940, and it is,
Madam Chair.
Representative Knoblach. You know, I might just have a brief summary of this one by Ms. White, if you wouldn't mind, Ms. White, before we adopt it. Oh, excuse me, Katie. But Ms. Kavanaugh.
Madam Chair,
Okay.
other than it's all healthcare, it's really, there isn't any, do you want me to go through all the
No,
sections?
just I mean, it is somewhat, looks complicated. Anything that stands out that we should take a look at? Section 12, the DHS to reconcile the Minnesota care premiums. Just, if,
There, well, you know,
Ms. Kavanaugh.
so in the amendment, Section 1 is, you know, it requires the state agencies to specify specific information from the LAC when they're asking for federal funds. Sections 2 and 13, that's requiring the Department of Public Safety to share Social Security numbers with DHS for purposes of recovery of benefits. Section 3 is the requiring MMB approval for agency fund transfers other than the routine administrative operations when moving from fund to fund. Section 4 is requiring DHS to contract with a vendor to verify eligibility for MA, Minnesota Care, and SNAP enrollees. Section 5 is allows DHS to exempt a rehabilitation agency from termination or denial from being a Medicaid or provider. Section 6 is the telemedicine, allowing community paramedics to be a provider of telemedicine. Section 7 requires the DHS to contract with a vendor for the oversight of the non-emergency medical transportation providers. Section 8 prohibits terminated non-emergency medical providers from re-enrolling for 5 years after they've been terminated. Section 9 requires DHS to make training materials and other information available to non-emergency medical providers. Section 10 allows providers to not provide the screening recommendations added on or after January 1st, 2017, and would still receive full reimbursement under the Child and Teen Checkup Program. Section 11 requires DHS Healthcare Services Policy Committee to make recommendations on non-pharmacological pain management. And Section 12 requires DHS to reconcile the Minnesota care premiums by July 1st, 2018. And that's the article.
Thank you, Ms. Kavanaugh. Is there any questions on this article, members? Discussion? Okay, Representative Knoblach.
Well, Madam Chair, I'll move the language that's just been described, the A18-0940 language, Article 22, which is sections 1 through 13 of Article 22, page 1, line 4 through page 12, line 26. And the language in that article is as was described by Ms. Kavanaugh.
Thank you, Representative Knoblach. Representative Dean. Oh, excuse me, Representative Dean. I can't see you guys.
We were just wondering if staff might be able to help us with an amendment on the eligibility verification piece.
Representative Dean, we cannot hear you.
Oh, I'm sorry.
Please.
Is it not working? There we go. On section 4 of the bill to add the CCAP program for the eligibility determination in those sections.
Senator Rosen.
Representative Dean, do you have the amendment, or is it an oral amendment?
Madam Chair?
Ms. White?
Madam Chair, we do have an amendment drafted, but it's not drafted to the delete everything amendment in front of you. It'd be drafted to the language in the side-by-side, and we'd have to make copies of that. But the amendment basically adds references to the CCAP program every place that MA, Minnesota Care, and the SNAP program are mentioned.
Thank you, Mr. Chun. Ms. White?
Oh, Madam Chair, is this what I do?
Ms. White?
Yeah, I think we can just do that orally if you want
Okay,
to.
if you'd like to march through that, we're working on page 3.
Yes, page 3, line 26. Before "and," insert child care assistance program. And in every other instance where it says Minnesota Care, comma, insert child care assistance program in section 4. Okay.
So it will read, "The commissioners shall ensure that medical assistance, Minnesota Care, and child care assistance program, and supplemental nutrition assistance program, SNAP." And so that would be found in subdivision 1, paragraph A, paragraph B. Where else, Ms. White? Would it be in subdivision 2?
Madam Chair, yeah, on 4.14, 5.9.
That's it.
And if you want to direct staff, if we missed one, we'll put it in as a technical amendment.
Would that, Ms. White, it would be also on 5.9?
Yes, 5.9.
5.9? Okay, I cannot hear you that well, that's why I'm
Oh,
having
I
a little
don't know
problem
how
here.
to use these
So, we're
things.
yeah, pull that forward, please, thank you. Is there any discussion to this oral amendment? Actually, Representative Dean, is that what you were thinking?
Yep, just so that it catches all of the provisions. I think she's got them.
Great, okay.
Madam Chair,
Representative Knoblach?
I can incorporate that into my motion that we add that child care assistance program in where staff mentioned. I think it was page 3, line 26, page 3, line 32, page 4, line 14, page 5, line 9, and staff to make any other technical corrections to add it where necessary.
That'd be wonderful, okay. Yeah. All those in favor of the oral amendment by Representative Knoblach, say aye. Aye. All those opposed, nay. Motion prevails. Okay. Senator Benson, you had your hand up.
Madam Chair, it was just to get your attention in case you couldn't see Representative
Okay.
Dean. And Madam Chair, and for those of you who weren't here when Representative Garofalo was offering amendments, we're not going to make a habit of doing this.
Thank you, Senator Benson. Yeah, we learned our lesson on that one. But that was a good amendment, and appreciate this oral amendment to straighten this out. With that, we have the motion before us from Representative Knoblach, the amended motion. Further discussion on that amended motion. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Article is adopted. On to Article 23, please, Representative Knoblach.
Well, Madam Chair, I'll move Article 23, which is the language contained in A18-0934, and it is a number of sections. I think, Madam Chair, I'm going to Well, I think it's going to be easiest to just adopt all the sections, which is sections 1 through 50, which would be page 1, line 4 through page 36, line 16. Excuse me, I'll make that 1 through 52, sections 1 through 52. And I see, Madam Chair, that there is a repealer in section 52. So if we could have staff speak to the repealer or prepare to speak to the repealer. And let me just say that this section or article relating to the Health Department covers a number of miscellaneous topics, modifies well and boring provisions, directs the Commissioner of Health to regulate security screening systems, allows training grants to be awarded under primary care residency programs for the duration of the residency, has a lot of provisions modifying provisions governing home care providers and the supervision requirements for technicians in tattoos and temporary body piercing, establishing certification requirements in certain cases, requires a report evaluating the results of opioid abuse, directs the Commissioner to submit a plan to reconstitute the Autism Spectrum Disorder Task Force, requires the Commissioner to develop a strategic plan to provide more information about the human herpes virus. And Madam Chair, we also have the repealer I mentioned, if staff could talk about what that is.
Yes, thank you, Representative Knoblach. Ms. Kavanagh.
Madam Chair and members, the repealer, paragraph A repeals obsolete provisions regarding the tuberculosis prevention and control and the transition to a new licensing structure for home care providers. And paragraph B repeals the requirements for body artists to supervise temporary artists. New language is being added in this article to take the place of that.
Thank you. Any questions? Discussion? Senator Benson, could you please explain Section 47, the report evaluating results of opioid abuse prevention pilot project that was funded for FY19, the Senate provision, please?
Madam Chair and members, this is related to the Project ECHO, and when we added money, we had to update the reporting requirements so that we would get a report as the money was used instead of after just the first grant. I believe, I'm trying to make eye contact with Ms. Kavanaugh, and she nodded, so I got that right. Thank you.
Okay, thank you.
So, in Madam Chair,
Ms. Kavanaugh.
if we don't,
Ms. Kavanaugh.
if it ends up if we don't fund that pilot project for fiscal year 2019, we'd probably take this section out.
Ms. Kavanaugh, I didn't hear that. I'm sorry. What's that?
If we don't end up funding the opioid prevention pilot program for another year, so for fiscal year 2019, we'd probably take this section out because you
I see.
wouldn't need to extend the report.
I see. Okay. Thank you very much. Okay, with that, we do have a motion before us. Is there further discussion, comments on this Article 23? Representative Knoblach renews his motion on Article 23. I won't go through the whole thing. All those in favor say aye.
Aye.
All those opposed say nay. Motion prevails. And members, we have Article 24 before us. Actually, members, I think Representative Knoblach and I need to take a quick recess. We are in recess. Committee will come to order. I would also like to welcome Senator Abler. Hi, Senator Abler. I didn't even see you over there either. So you're sitting there too. He has the policy division, or one of the divisions of Health and Human Services, and the best one. There you go. We have Article 24 before us, members, and Representative Knoblach.
Madam Chair, I'll move Article 24, which is the A18-0939 language, page 1, line 4 through page 16, line 28. That's sections 1 through 13. There is a repealer in section 13 that I'd like staff to look up to tell us what that is once we get to it, but just briefly a description of what's in the article. We require coverage for 3D mammograms, allow short-term coverage to be provided for less than 12 months with one renewal, require certain information to be provided for patients with notice of facility fees, prohibit a health plan company or PBM from charging enrollees more than defined allowable cost for a covered medication, regulates surprised billing, regulates other PBM contracts, allows county sheriffs to operate alternative medicine disposal programs, and deals with time limits for controlled substance dispensing and refills. Madam Chair, that is my motion. If we could recognize staff to tell us about the repealer.
Thank you, Representative Knoblach, for a very good summary, I must say. Ms. Kavanaugh, on the repealer?
Madam Chair and members, the first repealer repeals the section that, which excluded the short-term coverage from loss ratio requirements. And the second repealer repeals the current cancer drug repository program.
Okay, thank you. Representative Dean, thoughts? Representative Schumacher? Senator Benson?
Madam Chair, just briefly,
Senator
this
Benson.
contains a lot of the work from the Senate Select Committee this summer. We were looking for ways to have consumers more engaged and create some transparency, and a lot of that is reflected in this article.
Very good. Thank you. Any discussion on Article 24? Okay. Representative Knoblach renews his motion on Article 24. All those in favor say aye.
Aye.
All those opposed say nay. Motion prevails. Article is adopted. Okay, members, we are going to pass out Article 25, 26, and Article 25, 28, and 29. Okay, members, we have Article 25 before you, 28, and then it says Article 1, which is actually Article 29. That has been revised because they put in the chemical and mental health and state-operated services. So we are going to start with Article 25. Does everyone have it?
Yep.
Okay, perfect. Representative Knoblach.
Well, Madam Chair, I'm going to move some of the language in the A18-0933 language. Madam Chair, I move sections in Article 25, Sections 3, Sections 5 through 32, Sections 33, 34, 35, Sections 36 through 40, Sections 41 to 44, Sections 45 to 50, Section 59, Section 51, Section 60, and Section 61. This article deals with health-related licensing boards. I'm not moving the sections that deal with the advanced practice registered nurses, giving them authority to engage in different administrative actions. I guess we're going to get to that separately. So for now,
Mr. Chair?
I'm only moving the other sections which relate to establishing health service executive licensure, converting the license renewal cycle for allied professionals regulated by the board, modifying fees for various boards, optometry, social work, modifying dental licensure provisions, establishing emergency prescription order standards for pharmacists, temporary license suspensions and background checks for health-related professionals, modifying continuing education requirements relating to opioids, language relating to the EMS regulatory board, and there is one repealer at the very back section, actually two repealers, Section 61, that I'd like you to recognize staff to describe.
So Representative Knoblach, you did not move sections 1, 2, 4, and 52 through 58, is that correct?
That is correct, Madam Chair.
Thank you.
Mr. Chair, if I can
Senator
just comment.
Senator
Madam
Kiffmeyer.
Chair, sorry. So just to let you know, all of this is in a bill that has passed off the Senate floor, concurrence in the House floor today, so it's on its way to the governor. There have been no negative votes, so we're expecting it to be signed, and so the stakeholders said to not adopt it in this bill.
So Senator Kiffmeyer, you're talking about that first sections 1 and 2, 4, and 52 through 58.
That's correct, Madam Chair.
The advanced practice registered nurses. Okay, so that is already done.
But
Thank you.
that's why.
Senator Kiffmeyer. All right. And Ms. Kavanaugh, can you speak to the repealer, please?
Madam Chair, one of them is an obsolete section regarding criminal background checks that we don't need anymore, and the other one is obsolete rules on license renewal.
Okay. Great. Representative Dean, Representative Schumacher, thoughts, questions, comments on this article? Senator Benson.
Senate
Senator
concurs.
Abler. Senator Benson, are you good?
No, I said Senate agrees.
Okay. Can see you. Okay, great.
Madam Chair.
Yes, Representative Knoblach.
Madam Chair, I'm wondering to either the Senate or the House regarding the modified fees for the Board of Social Work. I'd seen some reference in our table describing the side-by-sides about an amendment modifying fee amounts. Is there an amendment that is up for consideration here that someone is bringing?
Representative Dean.
Madam Chair and Representative Knoblach, the fee increase that was approved that we heard the most about was the one that you're referencing. And in between the first stop and now, it has been adjusted down 50%. So that's been knocked down in half already. And that's already incorporated within what's before us right now.
Thank you,
Representative
Representative Dean, and thank you, Madam Chair.
Okay, thank you. So questions and discussion on Representative Knoblach's motion to adopt Article 25. All those in favor say aye.
Aye.
All those opposed say nay. Motion prevails. Article is adopted. Representative Knoblach to Article 28, the A18-0946, Children's and Families Licensing. This is mine.
Madam Chair, I'm going to move the language described as A18-0946. And that would be sections 1 through 25, be page 1, line 4 through page 20, line 2. And Madam Chair, this is the Children and Families licensing section. It has a number of CCAP provisions, provisions related to child care, has a number of provisions related to child foster care, requires an annual foster care training. Family child care training hours are regulated and described. Extends the American Indian Advisory Council, requires some reports, extends the American Indian Child Welfare Advisory Council, establishes the Foster Care Sibling Bill of Rights, requires commissioners and revisor to work together to consolidate DHS and MDH functions in the Department of Investigation, Compliance, and Eligibility, creates a DHS restructuring working group, has some other language relating to child care licensing rules. Madam Chair, that describes sections 1 through 25 in Article 28.
Thank you, Representative Knoblach. Representative Dean, Representative Schumacher? Okay, Senator Abler.
Thanks, and I hope I can be loud enough here. Just a couple things to highlight. This actually has a fiscal impact where it spends $60 million in federal block grant funds for child care. And the most noteworthy of that, the Senate accepted the House's position on the homeless funding, so some people are interested in that. But the takeaway on this is that with the concern about the tails that this may create, the rate will go up to a maximum of 25% of the 2018 survey. If the federal block grants never get replaced on the $60 million side, then that rate would float to handle available funding, and that's, I think, a key difference. And then also, just to put a nod out to one other item in the bill, and the department at one point expressed an interest in wordsmithing the language on Section 22, which is bringing back a plan where the oversight of the Department of Health and Human Services would be created into a third entity. So all the licensing, all the investigations, compliance, and eligibility work would be done in this group. This is just a plan. It doesn't require them to. It would come back here to be done. But with a nod toward Mr. Johnson and Ms. Ham for their durability at our hearing today. And I truly appreciate them and their work. I think this would be a good kind of a way to improve everything that we're all after, both at the department and here. This would then be left into the hands of whatever new governor we have to really fully execute. So that's the highlight of that area.
Thank you, Senator Abler. And I am looking for a particular, thank you very much for Section 11, Assistance for Persons Who Are Experiencing Homelessness. Thank you. It's a very important section and could make a tremendous difference. Any more discussion on Representative Knoblach's amendment to adopt, I'm a little confused here, 1 through 25 sections? All those in favor say aye.
Aye.
All those opposed say nay. The amendment is adopted, or the motion is adopted. Thank you. And Representative Knoblach, we have Article 1, actually, members, in front of us. It's 29 on your tracking sheet, the state-operated services and chemical and mental health. Representative Knoblach.
Well, Madam Chair, I'm going to move the language that's contained in A18-0935. I move sections 1 through 12, page 1, line 4, through page 13, line 25. There is a repealer in section 12 that I'd ask staff to look up and be ready to describe when I'm finished describing the rest of the items that are in this article. This deals, as we mentioned, with chemical and mental health, establishes post-arrest inmate mental health screening and data procedures, modifies various human service licensing provisions for providers of behavioral health and substance use treatment services. It strikes language allowing DHS to use CCDTF treatment funds for administrative purposes, provides for medical assistance coverage of post-arrest care coordination services, and repeals rules related to changes in CD treatment assessment needs process. I guess that's the repealer, but I do want to have staff confirm that.
Thank you.
That's my motion.
Thank you, Representative Knoblach. Ms. White on the repealer?
Madam Chair, actually, it's a House-only provision, so Ms. Sarah Sunderman.
Ms. Sunderman.
Madam Chair, the repealer relates to, it repeals some rules related to the assessment of need process for chemical dependency treatment licensing. And the repealer is there because of some provisions in, let's see which section. In sections 2 through 6 and section 8, they changed the process.
Thank you, Ms. Sunderman. Okay. Discussion, Representative Dean, Representative Schumacher, Senator Benson, Senator Abler. Okay, great. Discussion on the Article 1 motion from Representative Knoblach. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Okay, members, we have two more articles left for you. They are being passed out right now. So, Article 31.
I wanted to announce. On the child care. Surprise it.
So members, we have Article 30 and then the forecast adjustments that are going to be passed out. We are not doing Article 9, the miscellaneous, on your sheet. Okay, Representative Knoblach.
Madam Chair, I'm going to move the language in the A18-0938 that was passed out. Madam Chair, I'm going to be moving sections 1 through 34. There is a repealer in section 34. I'll ask staff to be able to describe when we're finished. Madam Chair, this relates to community supports and continuing care, modifies a number of existing adult foster care moratorium exceptions, modifies HCBS standards, has various modifications to min choices, establishes new requirements for receiving a PCA enhanced rate, extends for 5 years the TBI Advisory Council, modifies the Housing Supports Program, establishes an electronic visit verification system, permits a Hennepin County Housing with Services Establishment to redistribute its bed capacity, and has the repealer and reviser's instructions. That's my motion, Madam Chair.
Thank you, Representative Knoblach. And Ms. White on the repealer, please. Oh, Mr. Monahan, thank you.
Madam Chair, the repealer repeals a paper-based visit verification system for PCA services, which is being replaced by the electronic visit verification system that is in the bill.
Questions, comments on that? Representative Dean, Representative Schumacher? Looks good. Senator Benson, Senator Abler? Looks good there, too. Okay. Members, any discussion on the 8:30 motion by Representative Knoblach? All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Members, we have one more article in front of us, Article 31. It's the Human Services Forecast Adjustment. It's the A18-0937. Representative Knoblach.
Madam Chair, I'd move the forecast adjustments article. It's Article 31, page 1, line 4 through page 2, line 30. And this is a standard motion to conform to the budget forecast.
Thank you, Representative Knoblach. Are there any discussion questions to this article? Representative Dean, Representative Schumacher? All good. Senator Benson, Senator Abler? Thank you. To Representative Knoblach renews his motion on the Article 3A18-0937. All those in favor say aye.
Aye.
All those opposed say nay. Motion prevails. Okay, with that, we do not have anything else to work with on Health and Human Services, so we're going to lay this aside, members. And we're going to go back to our other books. I believe we are ready for the housing discussion. And we're in recess right now to get this organized. The meeting will come to order. Members, we are going to work on Article 8, the housing article first, but before we do that, I just have a brief announcement. We are not going to be doing the energy article tonight or no more HHS. Thank you, Brian. I kind of forgot. So we're just going to wrap up on the housing provision at this point. Welcome, Representative Garofalo. Of course, you serve on this committee, and Senator Westrom. I'm getting punchy. Welcome. We have your housing article in front of us. Who would like to go first and just kind of a brief summary? Senator
Madam
Westrom.
Chair, you tell us how much detail you want, and we can give you as much or as little as you want. Generally, the provisions in front of us on the housing, we've come to agreement with the House and Senate. I'll let Representative Garofalo walk through some of it, or staff, if you want more detail.
Representative Garofalo.
Yeah, thank you, Madam Chair. And first of all, I want to thank Chairman Knoblach for his work on this article. There's a lot of complex things in here, and I want to thank him for his leadership on it as well. But thank you, Senator Westrom, for your work as well, and we've reached an agreement on this article. Madam Chair, there is one amendment that has been passed out, so I don't know if you want to move the formal article in front of us, and then we can move the amendment. But there is agreement between the House and Senate on this. And thank you. As always, it was great to work with Senator Westrom. So this just the one amendment right now that I'm aware of, Madam Chair.
I agree. I think we will move the article. Representative Knoblach, would you like to move the article, please?
Yes, Madam Chair, I will move the language in Housing 18. That's Article 8, Sections 1 through 46. It would be page 1, line 1 through page 46, line 9. There is one repealer that I would mention that I think we need to have staff identify. And I guess, Madam Chair, we could, I don't know if you want me to talk any more about what's in it, being we have the presentation from the housing people here. But there's one, as I make the motion, Madam Chair.
Mr. Chair, Representative Knoblach, we're going to wait on that for a little
Okay.
after testimony. And
Oh, all right.
Okay, thank you. Mr. Knopf, I will ask you to do the repealer, though, if you could.
Madam Chair and members, the repealer was from the House language, and it repeals an exception. There's basically a rent control prohibition in statutes, but there are exceptions, and this repeals the exceptions.
Okay, thank you, Mr. Knopf. With that, I think we're going to move to the Commissioner Tingerthal with MHFA, please. Welcome, Commissioner.
Thank you, chairs and members of the conference committee. Many of the concerns that we have with the housing provisions have been expressed in a letter to the chairs, and I was disappointed to see that essentially none of these concerns have been addressed with the new language that you have today. In fact, we now have a housing provision of an appropriations bill that includes numerous policy provisions and no appropriations, including an appropriation that was in the House bill earlier for the proven Homework Starts with Home program. Of equal concern is significant new language, which none of us had seen before in Section 11, Article 8, that has to do with some fairly complex changes to the section of state law that deals with allocating tax-exempt bonds that are used for housing, and that we have not seen until the bill was posted 2 hours ago. There are significant changes that potentially cause conflict between federal and state law regarding the allocation of federal housing tax credits, which is the largest resource that this state receives from the federal government for new affordable housing. Among other things, the new language appears to remove the authority of the designated allocating agency, and in the case of the state, that would be the Independent Minnesota Housing Finance Agency Board, and give a priority to a project, a single priority and the highest priority to a project simply by means of having received an allocation of tax-exempt bonds, that it should therefore receive an allocation of tax credits. We feel that this really undermines what has been a strength of the federal tax credit program for more than 30 years. And we've heard this from members of Congress, that one of the strengths is the oversight of the allocation of tax credits to rental housing developments that is provided on a state-by-state basis, and therefore is, really looks to curb any would-be abuses by developers that may reach too far. In fact, one of the items that's included is a prohibition against an allocating agency having a provision that would require cost reasonableness of a project. So we're concerned. We haven't had a time to look deeply at the language since we've had it such a short time, but we are very concerned about these provisions. There is one other provision that came from the Senate bill that we have expressed concern about, and that is a provision that instructs the Housing Finance Agency in the utilization of funds that are within the purview of the agency and do not come from appropriations. And we expressed our concern again about that and the way that it challenges the governance of our independent board. So with that, Madam and Mr. Chair, those conclude my comments.
Thank you, Commissioner. Are there any questions, discussion for the Commissioner? Thank you very much, Commissioner. With that, Representative Knoblach, I know you do have an oral amendment, and then Representative Garofalo will get to yours.
Well, Madam Chair, in reference to some of the concerns that the Commissioner expressed about Section 11, I'd like to remove language. This is actually a bill that I have that is page 10, lines 26 through 28, which deals with setting standards in regard to what can or cannot be considered when they're granting tax credits and doing approvals. And so, Madam Chair, I guess I can incorporate that into my amendment, or we can vote on it, however you want.
I'd like to vote on that.
Okay, so I would move the removal of page 10, lines 26 through 28. And this would allow things such as the cost per unit for a housing project to be considered when these decisions are made.
Thank you, Representative Knoblach. Representative Garofalo?
Madam Chair, I support the amendment and thank the Commissioner for bringing Representative
Senator
Knoblach.
Westrom?
Madam Chair, I too, Representative Knoblach, just to verify, that's language we were just talking about a little bit before the meeting started, that would be removed.
Representative Knoblach?
Yes, that is Senator Westrom.
Okay, thank you.
I'd support the amendment, Madam Chair.
Thank you, Representative Senator Westrom. Representative Knoblach moves that page 10, line 26 through 28 be deleted. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Okay, Representative Garofalo.
Madam Chair, I would like to move the SF3656 Housing 1 amendment. And this is technical in nature, nonpartisan staff and Senator Lemmer worked on this. There was a reference regarding the discharge of restricted covenants that was in the bill that was made a statutory reference, did not exist. So we're correcting that and making sure that it's all hunky-dory.
Thank you. Well, I'm going to vote for it because it's in paper.
A Garofalo paper amendment.
A Garofalo paper
Madam
amendment.
Chair,
This is
we are setting the bar low. We are setting the bar low.
least there's a bar. Okay, any discussion to the SF3656 Housing 1 amendment? Just Senator Garofalo renews his motion. All those in favor?
Whoa, whoa, don't call me a
Oh,
senator.
Representative Garofalo renews his motion. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. The amendment is adopted. Okay, so we have before us an amended Housing 18 article. Any further discussion? Comments? Looks good. Representative Knoblach renews his motion on Housing 18, Article 8, amended article. All those in favor say aye.
Aye.
All those opposed, nay. Motion prevails. Thank you, members. Okay, so looks like we have, oh, do we have to?
You are. Thanks, Tori.
Looks like we have still HHS to finish up tomorrow, Energy, State Gov, and Public Safety. So we have a full day. I'd like to turn it over to Representative Knoblach.
Well, Madam Chair, I will certainly be calling the conference committee again tomorrow. I guess at this point, I don't know that I want to give a time. I would imagine it would be maybe 1 o'clock, something like that. But we want to make sure that we have all the language available and ready to go. And so I guess watch for conference committee tomorrow at the call of the House Chair.
And Representative Knoblach, what time do you guys go onto the floor?
10 o'clock.
10 o'clock, and we are the same. Okay. Any questions? Discussion? Meeting adjourned. Thank you very much.